Hello, everyone. My name is Dr. Jenkins, and today I'd like to discuss with you the first chapter of your textbook, Quantum Leadership. So the focus of the first chapter is a new landscape for leadership, and it really emphasizes change and how a leader must be prepared. John Maynard Keynes once said, "The hardest thing is not to get people to accept new ideas, it is to get them to forget the old ones." So, and we've all been there and we know how that feels. So our society is just beginning to understand the impact of digitalization and what it has had and will have on communication, business, and politics. As you can see, digitalization has had a global impact. We are able to communicate instantaneously. We have communicative ways of receiving communication 24 hours a day, 7 days a week, 365 days a year. It's immediate, it's constant. We know exactly what's going on in all parts of the world if we want to. Business is also globally connected, and digitalization is one of those things that have impacted business extensively. It's no longer that an office has to be located in one particular country. It can have services throughout the globe, and digitalization has allowed that to occur. And then politics. What happens in one area of the world has an influence on what occurs in another area of the world. So digitalization has and will continue to impact our world. So during the industrial age, Newton's foresight of many of the things that he developed that centered around gravity and all of Newton's principles related to the physical universe influenced social theorists, entrepreneurs, and organizational people. So in the 20th century, using his principles, the focus on work was performing the right processes. It was focused on products and services of a consistent quality. So it was focused on the number, and they were all consistent, being of good quality. But in the 21st century, we've moved away from Newton into focusing on obtaining the right outcomes for whether it's an individual, a product. We're now focused on outcomes. So the industrial age meant being a good manager. You guided one's subordinates, much similar to being a good parent. You directed their activities in the best interest of the organization. So the managers basically used the acronym POLICE for planning, organizing, leading, implementing, controlling, and evaluating. It was a linear process, and that's what the main focus of the manager or leader was. In today's organizational design, if you see here in the center of the screen, there's the hierarchy. That can be more relatable to the industrial change, where change came and organizational design came from a top-down situation. So decisions were made at the top, and they filtered down to people at the bottom. On the left-hand side of your screen, you see a process design where it's a more decision tree type organizational design where decisions are made, well, if this occurs, then we'll go in this direction. But if this occurs, then we'll go in that direction, that type of organizational design. Now we're at a hierarchy decision-making, which is a relational design, where we make a change in one area, it needs to focus on, it's going to impact another one. So decisions and changes are going to be interrelational. So since we've moved from the industrial age into the digital age, that's where quantum theory comes in. And that was developed in the middle of the 20th century and has helped to create our newer technologies that affect life from the molecular to the global levels. We have to remember everything is linked, and events in one part of the universe affect another part in the universe. A change in one country is probably going to affect change in another country. A change in one area of the hospital is probably going to promote change in another part of the hospital. Everything is interconnected. So change is not a thing or an event, but rather dynamic, and it's just part of the universe. If you look back to the 1930s, Schrodinger had a think exercise, and it's called the Schrodinger box, which is down here in the left-hand corner, which shows a cat in a box, closed box with radiation and poison. His think theory was that the potential reality is that the cat could be dead or alive. Nobody would know what happened to the cat until the box lid is lifted off and you can actually see the condition of the cat, and that is the actual reality. So Schrodinger's box was developed to explain potential reality and actual reality. Your book also discussed the potential reality and the actual reality of a stop sign. When we're driving and we see a stop sign up ahead, the potential reality is that at some time the driver is going to need to stop. That's the potential reality. The actual reality is when the driver comes to the stop sign and actually stops. That's the actual reality. So how does that relate to leadership? The leader's role in change is to know that it's an unfolding reality. We never know, as we could plan for every single event, and the leader will not know exactly how everything is going to unfold. How we can perceive change, the leader can, but not everything can be known. The leader, when involved in change, notes its demands and its implications. We know that the change is going to probably have this outcome, but until it actually occurs, no one is exactly for sure. The leader has to be able to translate the change to other people, particularly those at the lower level of where the change might actually happen. They need to guide others to meet the demands of the reality, the existence of change, even though it may not quite be present. So the leader, when dealing with change, is actually living in that realm of potential reality. They can see the stop sign ahead, but until they actually reach that stop sign, they living in potential reality. They can anticipate the path of change, and then have to lead people and communicate with them to actually know what the change is going to be and when that change has occurred. So change has occurred in the landscape of healthcare. No longer are hospitals and healthcare paid for volume, so the number of surgeries or a type of surgery that an institution does. They're not based on that. They're paid for the value of the services rendered. So what were the outcomes? Remember, we have to keep people from receiving or having a hospital-acquired infection, because once a person has a hospital-acquired infection, then the hospital stops getting reimbursed. Healthcare is moving from institution-based to more community-based. It's on a continuum of care. It's not driven in the hospital. It's at the primary care at the level of your personal physician. It's creating healthy communities and not just treating illnesses. And the marketplace is such that everyone has access to healthcare. We may not feel it quite yet, but that's the direction that we're moving. The competition is to compete for quality and the impact on the healthcare system. So this really emphasized, and your book does a very good job of explaining it, that if you're institutional based, you can't be concerned about the hospital next door, the institution next door. People will come to you and physicians will come to you if you focus on quality. That is the reality of healthcare today. Everyone is accountable and coordinating services along the continuum. So everyone is accountable, from the healthcare provider to the person, the individual themselves that are receiving care. Everyone is accountable. Leaders in healthcare today have to get rid of everything that is comfortable to them. Again, we're in a changing environment. The leaders have to embrace change. If they're not willing to embrace change, then they're almost guaranteed failure. So if you can't embrace change, a leadership role is probably not going to be in your best interest. If a leader focuses on their past successes, that again is going to be a potential for failure. You cannot focus on the past, you have to focus on the future. So again, the leader has to close the door to the past, turn around and focus on the future. And that's what I already said on this slide here. But the other important component is communication. The leader has to have good communication skills in order for people to understand change and know what the future is. Leaders also have to possess that energy to be motivated to invoke that change. So those are two important qualities of a leader. energy, and communication. Very strong center points of being a good leader. So leader in healthcare have to be aware that people hate change. We have to admit it. We hate change. We like to feel comfortable. We can't do that any longer in any area of healthcare. Change is occurring daily, weekly, monthly, yearly. It's a constant now in healthcare. And we have to be, leaders have to be aware that they exist in a dynamic and emerging culture of change. So we have to embrace it. So what is quantum leadership? Well, it rules the day. We're there. We have to replace linear thinking. We can't go from step 1 to step 2 to step 3 and invoke change. We have to realize that we make a step forward, and then we realize that this change has occurred, and so that it has affected this. So it's relational, it's complex. Structure is about creating a context for action. So if we make a change here, we have to recognize that a change is going to occur over here. We have to know that where a change occurs, the fit must occur at the functional level, and then promote a good quality outcome. Technology has changed what people will do, how they live, and who they are. We know that just the way we communicate has changed on every level. A lot of people don't even have a home line anymore. We have our cellular phones, and that's what we rely on. We have all sorts of technology within the hospital, technology that occurs outside the hospital, even in our homes. We have smart homes. There's technology there that has changed our lives. Siri in our car has changed our lives. We can get directions just by talking to our car. So quantum technology, quantum leadership is reformatting health services. And we know that change is going to be continuous and constantly occurring. Healthcare will be provided in the digital age. It's already occurring. So leaders must replace traditional models of leadership and embrace a model that reflects complexity and quantum reality. Remember, living on accepting the reality, the potential reality of everything, not living in the actual reality, but that potential reality. And everything and everyone is part of a system. And once we make a change in one system, the change is going to occur in another system. We need a new understanding of planning. It needs to have a more global look. It can't, like I said earlier, it can't be about a step-by-step planning phase, because we have to know that no matter what we plan for, we can't plan for everything when we're involved in change. Leaders must find the right balance between stability and complexity. So what that means is that when a change occurs, a leader must embrace the change, celebrate the change, and then get their people to understand that change is going to occur again. It's like taking a long, deep breath for maybe not even a day, and then something is going to change again. Know that chaos is always present in the universe. And if you've taken theory then you need to go back and just look at the chaos theory. It's a constant in our universe. There is chaos everywhere. We know that it exists. It promotes change. A good leader will pay attention to the informal network. That is where life exists. If you remember the old adage of everybody knows what's going on by the network at the drinking fountain. I didn't say that quite right, but you get the best information at the drinking fountain. So you have to know about those informal networks, because as your book explains, sometimes that's the best way of getting change to occur, to know those networks, and where some ideas come out of those informal interactions. It's not always bad to be discussing things at the drinking fountain. But when the good leader needs to know that simple systems are linked together to create more complex systems. So if we have a simple system and move to another simple system and then connect another simple system, then it's going to create a complex system, and the easier it is to understand that complex system. Systems do not compete simply to seek and thrive, to compete, but simply seek to thrive in a network of intersections and interactions. So again, that interconnectedness of the systems. So that's how they work. Systems are interconnected and interact with one another. The compression of time will affect how work is done. We've seen that for a long time in healthcare. One example, this will tell you how old I am, but hip replacement surgery. You've seen major changes with that within the last 2 years, but think about me back in the good old days. I've been a nurse for over 40 years. When a person came in for a hip replacement surgery, they came in the night before, they had all their pre-op testing, and then they went down for surgery the next day. And then they stayed in the hospital until they could walk out, which was somewhere between 14 to 21 days. They were there. We took care of them. Then in the 80s, which was, we thought the Earth was going to explode, or life as we knew it was never going to exist. But there was a big change in Medicare rules that forced patients to come in the day of surgery, meaning that all their pre-op was done, their labs and everything were done prior to coming to the hospital. And then they had their surgery, and then they stayed for 3 days and left on the 4th day. Some went home, some went to a rehab center. Now, COVID changed everything, and I don't see us going back. If you have hip replacement surgery, which just happened to our neighbor back in January, he was in the hospital he came in the day of surgery and left the next day. He was out within 24 hours. I think the most we can anticipate is someone with a chronic illness that may need to stay for 48 hours. But I think that's the maximum. We are never going to see it go back to 3 days in the hospital. Something catastrophic will have to happen for somebody to be in the hospital for that long after a hip replacement. Cataract surgery is the same way. Cataracts, a person having cataract surgery, when I first started as a new nurse, came into the hospital the night before, went down for surgery, and then stayed horizontal in their bed with sandbags at both sides of their bed. They could not move their head for 24 hours. I had my cataracts replaced in January of last year. I went down to the clinic here, just a block away, actually, had my cataracts removed. It took them longer to prep me with all the eye drops than it did to have the cataracts. The cataracts are removed in 5 to 7 minutes, and I was home. And no restrictions whatsoever. That's the way cataracts have changed. It's unbelievable. So the compression of time is going to get even, is going to affect us in every avenue of healthcare. The point of service design, it's no longer going to change at the hierarchy at the level of the executive, at the executive level of the hospital. It's going to be at the point of service. That is where change is going to occur. So it's between the patient and the healthcare provider, be it in the clinic, in the doctor's office, and not necessarily even at the bedside in the hospital. It's going to have probably more of effect at the change out in the community. So the point of service. So what changes will occur in the next decade or two? Well, hospital beds will cease to be the main point of service. And during the next 2 decades, the number of hospital beds will decline by approximately 25%. So I would say as an advanced practice nurse, you will not be practicing in a hospital, even maybe as a hospitalist type position. You're probably going to be working somewhere out in the community. The service structure will continue to be decentralized. And all that means is that it's going to be structured more out in the community. We're going to be more services available, like at Walgreens, Costco or Sam's Club. All those types of services are going to have some type of health services. Services are moving out of the hospital. By the end of the next decade, more than 70% of the medical services will be outside the hospital. So you're not going to go to the hospital. A person that has chronic COPD that needs antibiotics are probably going to receive them in the home. You're probably already seeing that in the home. I know our neighbor across the street had, she's now moved into assisted living, but she has severe COPD, and she hardly ever went to the hospital. Users of health services will be more accountable. So we as a patient are going to be more accountable for our health services. We're going to be more participatory in our healthcare services. We are going to make our choices for what services we will receive. The users of health services and the technology are going to progressively interface. And we've seen this as a result of COVID. You now have the option, I know I have the option to, for my physicians to have a virtual visit instead of actually going to their office or clinic. So that we're going to see more and more of that. You can access your own chart. You can go online and see what your labs were, or the results of an x-ray. You don't have to wait to receive a phone call or to receive a letter in the mail. You can go online to see it. So those are the changes. These are changes that are going to occur within the next 10 to 20 years. And we're going to constantly see these changes occur. So be ready, embrace change. So I want to close with a quote from our former president, John F. Kennedy, back in the early 1960s. Change is the law of life, and those who look only to past or present are certain to miss the future. So I hope you're ready to invoke change, as I said just a couple of minutes ago. Be ready for it, and we're going to learn all about it and how a leader can deal with change. So it's been nice talking to you. I hope you learned something. Please read your textbook to learn more about some of the ideas that I shared with you today. Your book is quite interesting, I thought. So I will talk to you soon. Have a great day.